Health Secretary's made a commitment to eliminate new transmissions in England by 2030. Well, according to the latest figures, just over 100,000 people are living with HIV in the UK. It's estimated around 7,800 people don't even know that they have it. And in 2017, some good news, there was a 17% drop in HIV diagnosis. Well, I'm joined now by Kat Smithson from the National AIDS Trust and HIV campaigner Greg Owens, who's also... Owen. Oh, thank you very much. So I saw an S in your name earlier, but thank you very much. Greg Owen, who's actually living with HIV. Good evening to you both. Kat, I'm going to start with you. This is a very, very ambitious aim by the Health Secretary, Matt Hancock. And if indeed he's able to eliminate new transmissions by 2030, he'll be the first nation in the whole world to do that.
Yes, it is an ambitious aim, but it is one that is absolutely achievable, and it's really welcome that Matt Hancock has made this aim very clear and made this commitment to this aim clear today. Now we need to see that actually being backed up by investment in the right places. It's completely achievable. We've seen drops in diagnoses over the last couple of years, but the very services that have achieved those drops in diagnoses are under threat at the moment because of ongoing cuts to the public health budget, which funds those services. So that's sexual health services, prevention services. It's things like PrEP that we're struggling to actually get commissioned, the HIV prevention drug that we're struggling to get commissioned across the board.
Yeah, Greg, tell us a little bit more about PrEP, because this is something you're heavily campaigning for, to make sure there's better access to people, to make sure that this is a treatment which prevents people from contracting HIV.
That's correct. So PrEP stands for pre-exposure prophylaxis, and what that is basically it's a pill that you take before risk of exposure to HIV, and if taken correctly, it offers almost 100% protection against HIV for all people, regardless of sexual or gender identities. So it's a bit of a game changer. How we're still in the early part of 2019, and we're turning some gay and bisexual men away from clinics without PrEP because of a cap on the trial is a little bit outrageous. It's verging on criminal. So we would urge Matt Hancock, who has in principle agreed to support doubling the trial. Yes, yeah. We would ask local authorities and commissioners and NHS clinical reps and the Department for Health and Social Care, NHS England and Public Health England, all those complex myriad of players to get together now to really make sure we do this immediately. It needs to happen as soon as possible.
Because tell me your story, because you yourself was trying to get treated. Was this before you found out that you yourself had HIV, is that right?
Yeah, so I only really went for a HIV test to confirm that I was HIV negative, because I tested negative the year before, and I went for a test to confirm that I was negative to start taking PrEP, and then for me it was just a few months too late. So we're still hearing these stories. That's my narrative from 2015, and it really does pain me that we're still hearing these stories of people becoming infected with HIV, totally preventable HIV transmissions, because we're not making the tools available, all the tools we have. And the thing is, we're not going to reach these targets and this great ambition unless we utilise all the tools we have.
So, Kat, Greg was living with HIV and didn't even know it, and that is a huge problem as well. It's the detection that needs to be dealt with as well.
Absolutely, and testing services both within sexual health clinics and outside of those are some of those services that are funded through the public health grant, and they're really important because there's still a significant number of people living with HIV who are unaware that they're living with HIV. Once you're diagnosed, you can go on treatment, and actually when you're on treatment, you can't pass HIV on. So treatment not only has benefits for your own health, but has an ongoing preventive benefit as well. But those public health services are being dramatically cut. So we had an 85 million cut to the public health budget just this year. So all of this talk about prevention around commitment to elimination has to be backed up by investment in that area.
But just really quickly though, I thought in the capital that they've actually been on track in terms of the aims that they've had in place, which I think meet what the UN are trying to get them to do. Very quickly though, Kat.
Absolutely, yeah. So we are meeting targets there, but the idea is that in order to maintain that and to keep going, we do need to invest in the very services that have achieved that.
So a lot more to do.
Exactly.
Kat Smithson and Greg Owen, good talking to you both. Thank you.